Hello everyone, this is Thendo Bakali from Dynamic DNA. I am the business unit manager there for data science. Um, I just wanted to go through the report that I have worked on the COVID-19, which is the coronavirus, which has really disturbed the world right now. Everyone is talking about it. So the topic of my report is what do the numbers say about COVID-19? So we're gonna go through the numbers, and as you know, they always say numbers don't lie. You can always rely on numbers. So I'm gonna take you through some of the numbers that I pulled through. This report was designed using a couple of data science features like Power BI, Microsoft Excel, Python for coming up with models, but I didn't use much of the models here because the data is still a little bit sketchy, and we'll talk about that later. Right, so let's get to it. So as we move on, we'll remember now what actually happened in the beginning, and I'm just gonna focus here in the beginning on South Africa. On the 6th of March, that is when we got confirmation from our health department that we have a first person who was tested positive for coronavirus. But that time, coronavirus was just being the tests were only being run only if you were showing symptoms and you were coming from heavily affected countries such as Italy, like or most of the country in Europe. That was what was happening then. There was no designated places where you could just go and say, "I'm here for testing." So the story was that there was a group of 10 people who traveled to Italy, only 9 returned, and then within those, one of those people then tested positive for COVID-19. That was in the 6th of March. Now, since the 6th of March, or before even the 6th of March, most of us knew about this virus because it was already spreading all over the world. And we were already starting to take precautions in terms of our hygiene. And that's what happens. That's what we were advised to do as well. We started washing hands more regularly. We started being very cautious about people who were around, the surfaces we touch, places we travel. We started paying more attention to those things. And then we're now going to look at how the numbers started graduating from that first patient. We're going to call the person patient zero. How from patient zero to our current numbers, or just before measures were taken in South Africa, what actually happens on the numbers. So if we look at the following graph, we can actually see that here's where our first case was reported, somewhere in the 6th of March, when we started having our first few cases. And then somewhere there, 9, 10, 11, we're still within the right numbers. And on the blue side here, you will see that these are the cases that are being reported day by day. And then and you can see that I only stopped at 26th of March because there was a lockdown which was announced by our president to say we are going to lock down the country on the 26th of March midnight. Hence, I was stopping exactly here so that we see the impact of before the lockdown and after the lockdown, what is actually happening between those two. So you will see that the total numbers were usually increasing, yet cases which are being reported day by day were at a manageable stage. You could see the only spike we started seeing here when we started getting cases which were somewhere around 80, cases which are around 104. Those were now huge numbers of cases coming per day. And that was because the government was starting to put more attention to this, to say, let's put more resources to our airports, to our borders, to even other hospitals, so that we can test these people as they come in and they go. Hence, you see that here the numbers were still manageable because there was no much testing here. It was still that of saying, okay, if you have traveled somewhere, you can go to these laboratory services, and then they can test you. And there was some fees that you had to pay for that time. I think it was around 1,500 rand. Hence, you see the numbers here. This is when the government start pushing out testing, forcing people to test, especially those who were now second contacts, like people who were in contact with our first patients. They were starting to getting tested, and the numbers were rising, up to when we could see here, up to when the lockdown was announced. When the lockdown was announced, we were sitting very, very comfortably just above 1,000 numbers. But it was announced way before that there's going to be a lockdown. When we were still sitting at 600, they announced that we we're going to have a lockdown. And then the number started going up even just before the lockdown. And then there we go. Our president then announced the lockdown on the 23rd of March. If you can go back to the graph here, you will see 23rd of March. On that day, there was no only a few cases were reported, but immediately after they announced that there's going to be a lockdown, you could see this is when we start to see some heavy behavior between numbers of cases being reported per day and the total numbers of cases. Remember, the more cases we get per day, it will always increase the total number of cases that we'll be having at the end. So our president announced that there's going to be a lockdown, which is going to be going on for 21 days. And this is then what happens. Now, this is now during lockdown. And I've used a different graph here so that all of us can follow what's happening here. So this is when the lockdown is currently happening. We start immediately in midnight of 26 of 26 of March, midnight. That's when we only have 218 cases that were reported on that particular day, which raises the total number of cases to 927. The next morning, it was then announced that the numbers has risen up to 1,170. And then I don't have to go through number by number of what happens. But then as you can see, there was an indication that somewhere, somehow after the lockdown, the testing, the value of testing, they were now testing even huge numbers of people. But then the results were now even being pushed to come out even faster, other than the 3 days they used to have before. They were now even starting to have days testing happening in a rapid speed, getting the results in about 24 hours. Right. But then there was some hope here that the graph of daily reported cases, confirmed cases, is starting to flatten. That is what the president was announcing, that we need to flatten the graph. Even the Minister of Health, Dr. Zulum Kwiza, did say that if we can achieve at a flattening stage, meaning our graph should be flat, it should move in this stage. So this stage gave us a little bit of promise, as we are very familiar with data, that it looks as if the cases which are being reported per day are looking much more good now, like they're in good stage. But what we didn't keep in mind was the number of people being tested, and that is going to have a very huge impact. Later on, you will see how much impact it can have in our study here. Right. So these are the numbers so far up to yesterday, which was on the 4th of April, where in only 80 cases, new 80 cases were reported. But then it's becoming much more manageable these days. The previous days was only 43. The other day it was also 82, 27, 27, 46. So these are the numbers that every country will want to hear every day, that these are the numbers of people who have been confirmed to have coronavirus. But then the total, as I told you, the total keeps on increasing. The more numbers you keep having, the total also increase. And I have not even introduced the number of fatalities that we've had in South Africa, which are our death, which are related to coronavirus. But then I want us to look at something else as well. I want us to look at our population so that we begin to see How is this affecting? How is this lockdown going to be manageable? Right. So we're going to look at our population in South Africa in terms of numbers. We will see that we've got our KZN and KwaZulu Natal together with your Western Cape being the biggest of population. They consume a lot of people. There's a lot of people who are staying there. And currently, these are the only three provinces that are having huge numbers in terms of people who have been infected by coronavirus. It makes more sense because this is where more movement is found. And as you've heard, this coronavirus likes to move person to person very much. So since there's a lot of people here, um, there's a lot of cases that have been confirmed. Even resources are too much here. There's too much resource to test here. We can't say the same with Northern Cape, that they have enough resources. They've got so many idle villages that are sitting very far from testing resources, and the surrounding as well. The next one here will be your Eastern Cape, together with your Limpopo. Um, there are so many provinces, but they don't make huge impact. The ones that have much more impact, it's your Western Cape, it's your KZN, and it's your Gauteng. Those are the three provinces that I want us to really focus on when we speak of population. Not only that, let us now look at something which is coming now from the World Watch, in terms of when we look at fatalities which are related to coronavirus. How does it look like? Now, when we look at the age group of how many people actually end up dying, let's just put it like that, end up dying who are infected by this coronavirus. And you will see that the biggest number here, it's from people who are 80 years and above. Those people are at high risk, and we know for a fact that it could be related it could be because of their immune system. It's now no longer strong as a person who's, let's say, 9 to 19 years old, 20 to 29. These people are very strong, and as of today, we are yet to have anyone who had died who is between the age of 0 and 9. That is very good news for every parent out there to say, okay, it doesn't mean that these people have not been affected by the virus. Most of them have been, but then there's not been any fatalities. But then for those from 10 to 19, yes, there's been a zero point 0.2 fatality there. 20 to 29, 0.2, 30 to 39, fairly the same with these age groups. It starts to go up when the age group goes higher, like 40 to 49, 50 to 59, 60 to 69, 70 to 79, also on 8% there. It's very, very important that we keep that in mind. Why? Because if you look at this 80 plus, which is on 21%, then we come back to South Africa. In South Africa, in our population of around, this is a population, I picked up this from 2017, so this is from 3 years old data, but I'm going to use it because it's still much relative. We have only increased by around 3 million by that time. We were on 56 million, we are now on 59 million, something there. Now, it's still a very good data to use it. But then South Africa also has a huge population of people who are older than 60 years old. And if you go back to our previous data, you will see that the 60-year-olds, that's when the fatalities start to get more scarier now. 3.6%, it's a huge number, guys. Do not think it's a small number. And then now, for those who are 80 years plus, in South Africa, we don't have such data yet. But then, as I've already stated, these numbers, which are telling us at least 8.1% in 2017 were above 60 years old, it is something to be scared of. We must be very cautious of this. And then mostly, where are they coming from? They are coming from this province here called the Eastern Cape. This is from the data of 2019. The Eastern Cape, if ever coronavirus was to really hit us very hard, we will find that the Eastern Cape, which I'm unable to find here, Eastern Cape, which is this one. Eastern Cape could be the most affected one. That is based on the numbers. If it was to spread the way it's spreading, Eastern Cape could be the most affected one based on how many old people are situated there in Eastern Cape. Remember, those are the numbers. You must always abide by the numbers. We survive by the numbers. Numbers do not lie, right? Um, but then let's look at. I don't want us to only look at the bad things. I want us to also look at what is good that we can take from this. So let's look, for example, at this stage, the Eastern Cape, which is the province I'm talking about, only has around 25 cases that have been reported since up to 4th of May, which was yesterday, up to the 4th of May. So this is a good number for now to look at. But remember, this is also hugely affected by the number, the population number, which you spoke about earlier on. That the first provinces that are going to find it very difficult to contain this, it's your Gauteng, your KwaZulu-Natal, and your Western Cape, simply because there's a lot of movement there. They are usually our economic hub. That's where things are happening, your KwaZulu-Natal, Gauteng, and the Western Cape. But then remember, most people who are moving the economy in the Western Cape, most of them you'll find that they're coming from the Eastern Cape. So if that travel was not banned at this stage to say you can move from one province to the other, you are going to see a hike in numbers of Eastern Cape affected people. And then this is where we must be very cautious to say, if you are working in the Western Cape, KwaZulu-Natal, or wherever you're working, and you reside in the Eastern Cape, just remember that the numbers are saying that province has a huge number of people who are above the age of 60, and that age of 60, remember, takes you back to this data here, which tells you if you are 60 years or older, you are gonna put those people at risk. You might be falling under the 40 to 49, but then if you travel that side with the virus, you might then affect these vulnerable people who will be having weak immune system, which will later show us very dangerous data, which we don't want to look at. So those are the few numbers we must keep in mind as well. Right. What are the good things that are happening currently in South Africa? Minister of Health not so long ago announced that they're going to purchase, or they've purchased, around 67 mobile testing units, which means testing will now happen very fast. But they say there's also something you must keep in mind there. When we are testing people, let's say per day they are expected to test around 30,000 people, with results coming in about 20 to 30 minutes. So that means in a day, 30,000 people will know whether they've been affected by the virus or not, which might, it is a good thing. But then the bad part now will be the numbers that we might be looking at. Remember, places like New York, places like Italy, they only started reporting huge numbers because they intensify on their testing. They said, let's put more effort on testing so that we are able to control these things. But then remember, the more the numbers, we also have to now look at saying, can we control this? Can our government control this? At this stage, I think we can. If we just follow all those things they're speaking about, I think we can. Now let's look at the total graph now from the very first day we had a case up to the 3rd of April. It looks as if this graph it's telling us something. It's telling us that we are at a peak wherein we're moving, but then the minute we start having those 67 mobile testing units that they were talking about, this graph could look even scarier, guys. The numbers are saying it could look scary. It could go up than what you see right now. This is still nothing. The more testing we push through, and the quicker the results. If we are, for now, we've only tested around what? We've only tested, in a population of 59 million, we've only tested close to 50,000 people. That is disappointing, but that is because of the resource that we have. But then other countries are starting to throw in their resource, like Germany. They are sending us their test units and things like that. And some other organizations, they're also coming in board to help us on that one. So it's gonna help a lot to move this number to a point where in per day, maybe in a week, we'll be looking at close to 200,000 people have been tested. So let's expect this graph to grow even bigger. But then what are the effects of this graph growing bigger? If the graph is growing bigger, we are going to find ourselves being part of these stats at a bad way. This is the world meter now telling us that currently the cases for coronavirus are sitting at 1,200,000, and then the death it's sitting somewhere at 65,000. The recovery rate has been very good. You can see the in green, over 250,000. This is very good. But let's not forget the death as well. It's sitting at 65,000. Most of this death, you have seen that 21% of this death has been people which are above the age of 80. So let's make sure that we stay away from those people. We don't go visit them at this uh, 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 very very strengthening or stressing time. We don't go and try to infect them. Even if you feel like you're fine, we're being advised, let's stay put where we are until this thing is controlled. Why is it important that we look at all of those numbers? It's important to also look at the cases that have been closed already. The closed cases means that it's either someone has died on that case or they're fully recovered. And if you look at this other table here, you will see that we've had over 300,000. Numbers are going by. Over 300,000 cases have been closed, and 65 of those have been death. This is not good. But what about those ones which are currently open? These are where South Africa is finding themselves as well here. They've got a couple of people who are in ICU, a couple of people who are in critical or serious conditions, and those in mild conditions, and those which are unknown, those who are still feeling fine, they are showing no signs of anything. So we will want to find our numbers in this region. Every country wants to find their numbers in this region, but then for even in South Africa, you are seeing that it's almost a 95% chance and a 5% chance of those in critical. We have about 1,500 cases with about 40 something who are critically ill and about 9 deaths. So it's not really, it's still showing us the numbers are still on 95 to 5%. As I said, numbers do not lie. So in my closing, I know it's been long on this report. In my closing, I want us to look at when can we expect this graph that I talked about to at least cool down. When is that going to be possible? Then it forces us to go back and study something which happened in the in 1918. That was the Spanish flu. This flu also happened in the same manner that the coronavirus is behaving. It came out, everyone was panicking. Medical doctors were doing their best to find the cure, and then they only realized later in November that we now have a cure. Right, and I'm gonna point at a point where they found the cure. This was the point where they find the cure, right here. I'm not sure if you guys will be able to see. This was somewhere on the 2nd of November 1918. This is after so many people have been dying. These are tens of thousands of people dying almost per week, per day. The flu was so dangerous. When it started with a hype. Other countries decided to close down, others were open, strikes were happening, social distancing was also implemented, and things like that. This is when they find the cure. This is when the graph was going up. They find the cure, but finding the cure does not mean that the graph will go down. Obviously, finding the cure, by the time you find the cure, almost everyone is infected. So the graph continued to go up, but then the cure now was being rolled out. So that means people started to get better as you see the graph going down. So what does this say about our graph here in South Africa? Lucky enough, there have been countries, and this flu, this coronavirus, we've been told that you can heal normally, especially those people on those not so dangerous age group. They are able to heal on their own. We don't have really much confirmed thing. I'm not scientific that much to speak about other theories that are happening around there. But then we've been told that you isolate yourself, you treat yourself very well, you're gonna get better. If you feel very, very, very sick or you are experiencing worse symptoms, you can then call those numbers and then you get assistance, seek a doctor and things like that. So this tells us that this graph, we might, since we don't have a cure yet, remember that graph was also affected by the cure. Since we don't have a cure yet, we could expect this graph to even go higher. And now with the number of testing growing, even higher in a straight line, like going up in a straight line, shooting numbers. I don't have the confirmed numbers yet now, and I don't think any data scientist could come with a prediction here to say these are the numbers where we think the cure will be found. We don't know yet when the cure will be found. But then the minute we find there's a cure which has been announced and or a vaccine which has been announced, which is currently will be working by that time, that's the only time we can come and start predicting how far the graph can go if it was still going up, and how soon will it come down. And remember, there's also a risk that if it does come down, we'll then be left with those ones who were never exposed to it before, and then now there's a vaccine, and maybe they never got a chance to get a vaccine, and then they get infected while there's already a vaccine. But this is manageable numbers. It's not going to be that bad, and most of these cases are not really reported. So in closing, guys, for those who don't know, the government of South Africa has a website where you can go online and start reading whether you have symptoms, what can you do, like wash your hands and do those things that the government have announced that you must do. Right, and that's it from me, Thendo. Um, for more information, remember you can go to Dynamic DNA. You can then post questions there, and then we'll try to see if we can explain some of the things we have said here. Thank you.